If you're an occupational therapist or a family caregiver helping someone who has dementia, you've probably had this situation happen before. Your loved one is refusing to do something, lashing out, being really agitated during dressing or some basic activity, or flat out refusing to do it at all. Resistance isn't just frustrating in the moment, it's also heartbreaking. Hi, I'm Dr. Brandy Archie, occupational therapist and founder at AskSAMIE, where we are the place for answers for caregiving. Today, we're going to dive into some creative but research-backed, evidence-based interventions that actually work. And I promise there's no patronizing advice here. No one size fits all. We're going to get into things that will really be actionable and useful for you. Just science, empathy, and meeting people exactly where they are. Okay, so let's start with why the resistance is happening in the first place. Resistance to care in dementia really isn't about defiance. It's often a sign of fear, confusion, or simply a loss of control. The Alzheimer's Society reports that behavior labeled as resistance is usually just a form of communication. For example, someone might refuse to get into the bath because they don't recognize the caregiver, or they feel exposed, or they're really cold, but they don't have the words and the processing ability at that moment to verbalize all that. According to the Dementia Behavior Management Advisory Service, common triggers for resistive or agitative behavior include sensory overload, poor ability to communicate, unmet needs, or routines. So the first step is mindset, your mindset. See the behavior as a message instead of a problem. When you think about it from that lens, it makes it easier to decide what might be the next best step in that situation. So let's get into some actionable tips that you can use. First, let's talk about music. It's a gateway. Music taps into memory and emotion even at later stages of Alzheimer's and increase cooperation doing daily care tasks like bathing or dressing. There's actually an entire discipline related to this. It's called music therapy, which is an evidence-based clinical practice to promote health by doing things like stress or managing pain or enhancing memory. So try singing a favorite song before initiating care to maybe change the mood. Play calming background music to ease some transitions. It's just a couple of ideas in the ways that you can use music. You can also find some really great music therapy resources that are actionable for family caregivers at soundscapingsource.com. Okay, we alluded to your own mindset as a way to help with this, but you can also reframe the task itself. Instead of saying, let's get you dressed, say something specific and focus on them. Like, hey, could you come help me pick out your favorite shirt? Shifting from I'm doing this for you to let's do this together builds not only trust and autonomy, but it's really easier to elicit the action that you're trying to get to happen. Your words actually really matter, even if you're not getting an immediate verbal response from your person. Because if you're not getting that automatic response, they're probably trying to process what you said. So using fewer and more specific words can really help with their level of participation. The third strategy I want you to think about is using visual cues and familiar objects to help. So using pictures or physical prompts, like holding up a toothbrush instead of just asking, can help to elicit the action that you're trying to achieve. The visual cue goes with the words that you're saying, and so it makes it easier to process what needs to be done. Environmental and sensory familiarity really play a big part in helping to reduce anxiety and confusion. You already know this if your person's ever ended up in the hospital or a nursing home for a few days, and you saw how much struggle that caused in this changing environment. So do the best thing that you can within the environments that you're in to make things as familiar and as routine as possible to help ease with those transitions. One cool tool I just learned about is Xenia TV. There you can find videos that not only help with agitation, but also depict daily tasks. So you could play it before you're ready to help them get in the shower so that they're already primed and ready for this task without you having to give a lot of instruction. You also might consider using the hand-under-hand technique, developed by Tipa Snow, who is a wealth of information and an expert in the dementia care space and has a ton of free videos, so check those out too. This technique uses physical cues to initiate an action or cooperation with what you're trying to achieve. So instead of just grabbing someone's hand and pulling it to where it needs to go and doing it essentially for them, you're going to slide yours underneath and guide gently towards the thing that you're trying to grab. This builds trust It reduces the startle response of your quick movement of trying to take them to where they need to go. And it gives them the control so that eventually, as you're guiding them, they might get the picture and then it clicks and they do the movement themselves. You should also really consider timing and make sure that you're doing the most challenging things in the best time frame that works for your person. Don't push care or challenging activities when they're tired or overwhelmed. Instead, try for a little while to track the patterns. If mornings are not their best time, maybe we do showers and bathing before we go to sleep. And that way, mornings can be a little bit easier. Everybody is different, but I bet there are patterns in their behaviors. So try to pay attention to them and optimize for it. Behavioral symptoms in dementia often actually follow daily rhythms. One example of this is sundowning. So if you've ever noticed that your person gets especially agitated or more challenging to work together to do things in the evening, this is not, you are not the only one that it's happening to. Sundowning is a real thing. So your timing of the activities that you do really does matter. So let's wrap up with a couple of examples of what you can say in the moment. Instead of, hey, we got to take a shower, you could say, how about we go check the water temperature together and make sure it's right? This gets us moving in the right direction into the bathroom area. They see the water is running and the familiar towels and the soap is out in place. It triggers the memories of, oh, this is what I do when I'm in here and this is happening. And then they can facilitate the thing they've been doing for probably 70 or 80 years on their own in their life. You just need a couple of words to get the party started. Instead of, hey, don't worry about that, let me do this for you, you might try, hey, can we do this together? I think I need your help. Remember, especially if you're a child caring for your older parent, they're always the parent and you're always the kid. They're not forgetting that, right? And so, at least not for a very long time. So, if you play into that aspect, it can really help with tapping into the things they did for such a long time, which was caring for you. Validation, redirection, and offering choices all support dignity. And when in doubt, walk away. Come back in 10 minutes. You're not failing. You're adapting. Because listen, caring for someone with dementia is really hard. No matter how many tips and tricks you have, it's still a challenge. And someone being resistant to the care you're trying to provide can really leave you feeling helpless. But with creativity, compassion, and a few evidence-based strategies, you can turn these moments into connection, not conflict. You are not alone, and you are doing a lot better than you think. So don't forget to like and subscribe and share this video with another caregiver or clinician who might benefit from it. And while you're at it, go ahead and drop your favorite tip or challenge that you are facing in the comments so we can talk about it. See you in the next one.